Hey everybody, I'm Dr. Chad Woolner.
And I'm Dr. Buddy Allen.
And this is episode 44 of the Health Fundamentals Podcast. And on today's episode, we're going to be talking about the best non-surgical solution for knee pain. So let's get started. You're listening to the Health Fundamentals Podcast. I'm Dr. Chad Woolner.
And I'm Dr. Buddy Allen. And this show is about giving you the simple but powerful cutting-edge tools you need to change your health and your life.
So sit back and enjoy the show as we show you the path to your best life down to a science. So hey everybody, hope you guys are having a great day. On today's episode, we wanted to talk about something really exciting. We at our clinic have had for quite some time a conservative knee program, a program to help people struggling with knee pain, and it has gotten a lot of attention. But what we have found over the past year or so is we've seen a lot of questions, a lot of common questions. And so really what we wanted to do is take this episode of the podcast to answer a lot of those common questions so that people could really have a better idea and understanding of what this program is really all about, whether or not this might be a good fit for them and their circumstances and situation, and really be able to provide people here in our community a better idea of what it is that we do with this program. So with that being said, Dr. Allen, let's talk about some of those questions.
You know, the questions that we get frequently are, first of all, what is it and how does it work, or why does it work, as opposed to a million of the other things that we've seen out and about, or that we more commonly hear. So those are probably some of the, right off the top, like, will this work for me?
Yeah,
absolutely. And why?
Yeah. What's it all about? Just give me the rundown of what this program's all about. So from a mile up, what would we say to a patient who wants to know about the knee program? What is it that you guys do to help people with knee pain?
You know, this is actually something that goes back a little bit, that started with me personally. It was a very selfish reason to kind of get into the knees, because I had boogered up my knee at the gym and was struggling with it for quite some time, and I'd done a bunch of different things. And so, you know, it was kind of a long road to get here. And finally I found, we found what we do now, and it made a world of difference for me.
Sure.
So when the patients come and ask, first question that I always ask is, well, you know, how long have you been suffering with what you have going on? You know, kind of get an idea of where they're coming from. And then, you know, really the reason what we do works, or what we're doing for patients, is really to find out what it is that went wrong in their knees, and can we actually help them? You know, so we kind of have a process of, you know, we got to look at what things we're dealing with. You know, we look at x-rays. We have to know what the knee looks like, because in some cases it may not be, you know, we don't want to waste patients' time or money. So, you know, we want to make sure that
they're a candidate,
that they're an actual candidate, and that there's not total structural, you know, like if you have lost all your ligaments, or, you know, there's certain things we can do, and there's certain things we can't. And certainly we don't want to waste your time, your money, you know, we don't want to get your hopes up for something that may or may not work. So, you know, so when we start kind of looking at things, we have to know, one, if we can help you. And then as we go into it, we identify where you're injured, you know, like what's going on. And so we have to kind of correct what, you know, took you there in the first place. Yeah,
we rather, you know, that's the main thing that I would say, a couple things that differentiate this program and approach versus so many of the other different approaches out there is number one, this is a root cause approach, meaning our approach, we focus and look at, first and foremost, identifying what's the root cause, what got you here in the first place, rather than just alleviating symptoms, because symptom alleviation is temporary at best, you know, and that's, again, we see a lot of these patients coming into our clinic who have tried all the different things. They've tried the pain medications, they've tried the topical creams, they've tried the braces, they've tried all sorts of other crazy random things. And then obviously they've looked into and done steroid injections. Sometimes they've done surgeries, and yet still they're struggling with these things. And we would argue that many, if not most of these approaches don't get the results that patients are after, because they don't focus on really the root cause, right? And so from a mile up, so that patients have an idea of what it is that we do, our program, again, from a mile up, works so well because number one, we address root causes, but number two, it's very comprehensive. It's not a single magic bullet thing that we do, right? It's a variety of different things. And again, it goes back to that, what we teach our patients and what we teach our community is in terms of healing anything, there's a simple equation. What's that simple equation?
Do the right thing in the right order for the right amount of time.
That's it. That is the solution, right? So when we talk about that, there are a couple different things that we do. There's a couple different tools and modalities that we use to help patients, again, doing the right things in the right order. One of the common problems that we see with a lot of approaches is they prematurely start patients doing some type or some form of rehabilitation, right? And the problem there is that if you're dealing with a lot of dysfunction and or inflammation, that's a recipe for stirring up even more inflammation. And we understand that sometimes inflammation is a necessary and sometimes critical part of the equation. But our primary goal, number one, is to help patients eliminate or at least reduce substantially the inflammation and the pain. That's like primary goal number one. And I think patients are excited about that because
Absolutely.
They don't want to feel that pain. But we go beyond that because beyond that, we don't just want, we don't want temporary relief of that pain. What we want to do is start fixing the mechanical problems, because most of these problems that we see, the root cause in one shape or another is mechanical in nature, right?
Absolutely.
Either, like you said, it's either something's moving too much, it's moving too little, or just not moving right at all, right? And all the research that we see, in fact, there was a study recently published a few years back in Johns Hopkins put out, they said that the root cause of osteoarthritis of the knee is, they said, and I quote, unstable mechanical forces. And that's exactly right? It's a mechanical problem. So we start with this program, we utilize a tool known as knee decompression. And this is a very unique tool. We're one of the few clinics in the entire valley that offers this therapy. And what knee decompression does is it very gently helps to distract or stretch that knee joint. And when patients who have been struggling with knee pain, when they hear the thought of that, it almost feels
Just thinking about it
provides relief for them, right? And so it gently starts to kind of open that knee joint and gently stretch it. And what that does is that helps to pull inflammation out of the knee. But what it also does is it pulls synovial fluid back into that joint. Synovial fluid is that fluid that's in most all of our joints in our body that helps to keep them
lubricant.
It's a lubricant, and it helps to nourish those joints and keep them healthy. The problem with knees is that when you start to lose that joint space, you start to lose some of that synovial fluid, and it's not correctly bathing the joint like it should. And so knee decompression is a really powerful therapy that we've come to find provides very, very rapid results for patients.
Absolutely.
They feel it differently. Class 4 laser, maybe talk a little bit about Class 4 laser is another tool that we use.
So generally, while we're doing the decompression, we use our Class 4 laser that essentially helps accelerate healing by improving blood flow. It heats the joint. The light actually gets in and just helps those cells to repair faster.
Yeah,
it's soothing. It feels amazing. So while you're actually getting that knee opened up and that joint space opened up, we kind of just bathe that whole joint externally. We kind of bathe that whole joint with that heat of the laser.
And what's cool is research has shown that this particular laser, these frequencies and these lights that we use are able to penetrate fairly deep into that joint, and patients can feel it. It's a deep heat.
You bet.
It's not just this superficial heat. It's a very, very deep penetrating heat. And so that works really, really well in conjunction with it. So that's kind of step one. What we do in this whole process is really find out part of the process in which we find out if the patient is a candidate. Obviously, we do an evaluation. We look at x-rays and or other imaging if there has been other imaging that's been done. But we also provide patients with an opportunity to try this therapy to see if there's improvement with it. And the logic behind it's fairly simple, is if you get improvement, that's a really good sign that you'd be a good candidate for the program. And what we notice is more often than not, most patients respond very, very well to this therapy. They notice almost immediate improvement, substantial, sometimes complete improvement. That's not unusual for us to see that, which is really exciting for us. And that's one of the things that we love about this program. And so we start by using that therapy, but beyond that, what we utilize as well in conjunction with this is a form of regenerative medicine. And regenerative medicine right now, as it has been for probably the past 5 to 10 years, has kind of been a little bit like the wild, wild west in terms of there's a lot of different approaches. There's a lot of different products out there that are being used. We're familiar with a lot of different ones because we've used them. Yeah, we've used a handful of them. So maybe talk a little bit about regenerative medicine as a whole, and then maybe what kind of caused us to hone in. Because again, you had a person, you were the first, I think, to have an experience with the tool that we use now.
So we, like we said, this started years ago for us, and basically we utilize a few different products. I've actually had we've all heard of stem cells, right?
Yeah.
And I've had stem cells and now the product that we're using now, and both of them were amazing, but the product we're using now was every bit as effective as stem cells at a fraction of the price.
Yeah.
And
so patients understand, like, regenerative medicine means a lot of different things, right? People maybe have heard of PRP therapy, platelet-rich plasma, where you basically draw the blood, you spin it down, you extract the platelets, and then you inject those back into the area. And the idea is that it stimulates healing. It's great. It works good. Then you have a variety of different stem cell and or stem cell derived products. You have different growth factor type products that are out there as well. But at the end of the day, regenerative medicine has a lot of different tools, and I would argue that most of them are good.
Absolutely.
What we have come to find, though, again from personal experience, is we believe this is the best.
And we believe it's the best one because it's actually within people's grasp.
Financially speaking, it's affordable, far more affordable. Yes.
So, I mean, if we can't afford to have a procedure,
doesn't matter how great it is,
even if it's magical, it's like it doesn't do us any good. So this this product is amazing.
Absolutely. Yeah. So tell them about your knee, what was happening with that. And then,
so I tweaked it at the gym, and for, I bet it was a year and a half, I was trying different things. I was wearing I had to wear knee braces to the gym. I couldn't I'd just hobble out of the gym every day. I couldn't squats. I mean, I would do them, and then I couldn't kneel. I couldn't kneel on the ground anymore. I couldn't pull my heel to my butt. It's like it was really bad for quite a while, and then I got my injection, and it was probably about a month after I had the injection. I was at the gym, and I had forgot to wear my knee brace, and I finished my workout, and I was like, wait a second, my knee doesn't hurt,
Yeah.
And then I was, and before that, I wore my knee brace every day, every time I would work out.
Sure.
And then following that, I'm like, well, let me try that again. And the next time I purposefully didn't wear it, and I was like, my knees still felt pretty good. And since then, I've done half marathon. I've done 3 Spartan races where you're jumping over things and
really
crawling
challenging
under
it,
things.
yeah.
And I've hiked to the top of Mount Bora. I've done a 30-mile backpacking trip with my boys. So, I mean, I've challenged the crud out of my knee, and I've had 0 issues. It's been amazing.
And the other cool thing about this is, how long ago was that?
The injection was easily 3 years ago.
3 years ago.
At least 3 years ago.
It's incredible.
And it was just last summer we did Mount Bora.
Yeah.
So, I mean, it was, it's kind of blown my mind, honestly, because I'm not kidding you. I could not kneel on the ground. It felt like I was kneeling on like pebbles.
Yeah.
It killed me. And to pull my knee to my butt just felt like my knee was going to pop,
Yeah.
And now it's like I can do all of those things with no issue whatsoever. So it's pretty.
Yeah, and the thing is that as exciting as this case is, we've seen this with so many other patients as well. And the thing that's pretty incredible about it as well is that what we've seen is patients who had felt like surgery was their only option, and it's exciting to be able to show patients that there is a conservative option out there that can help them potentially avoid surgery altogether.
Absolutely.
And really help them kind of reclaim life. And so we utilize these therapies, we utilize the regenerative medicine, and then in conjunction with that, we obviously want to focus on rehabilitation, strengthening and stabilizing that knee. And so we combine with that a nutrition and rehab program as a means of really rounding this out so that, again, this is number one, about helping to get rid of that pain and inflammation first and foremost, but regenerating that process, that joint, regenerating and starting to heal that, but then strengthening and stabilizing it so it's good to go moving forward.
Yeah, restoring proper function and motion is
exactly
going to make all the difference.
Yeah, well, and that's the point, is that's how we address really the root cause and really kind of get you back to full function and get you back so that you're protected, so you can kind of move and do the things. You know, so many people, whether they realize it or not, so many patients, when they come in, we find that the pain is not the real problem. The real problem, when we start carving away or kind of digging through, is it's what that pain is preventing them from doing.
That's it.
That's the real problem. People who want to hike, people who want to bike, people who want to work out at the gym, spend time with their kids or grandkids, or the various things that people want to do, that's the real issue. And again, that's what's so rewarding and fulfilling and exciting for us, is we get to help patients get back to those things through this program. So,
you know, one of the things that this program has done for me is, you know, growing up, we've all, you know, we think, oh, we're getting older, I can't do this anymore because it makes me hurt.
Yeah.
And we, you know, we heard our parents say it, we heard our grandparents say it, like, I can't do it. And the beautiful thing about this regenerative program, especially for the knee, is, guess what? You'd be surprised at what you can do. It's just not true. That's
you
kind of an old fallacy.
You don't have to accept that. It's exactly, it's a fallacy. You don't have to accept that. We hear that because it's, and quite frankly, what it really is it's a lazy answer.
That's right.
And without any disrespect whatsoever, but just saying I'm just getting older, that's part of getting older.
Just giving up.
Yeah, it doesn't, you don't have to do that, right? So hopefully that gives you guys a little bit better idea in terms of what the program is, how it works, why it works. The other question that patients have, does insurance cover this, right? And our answer is a big maybe, right? We always say maybe.
Every insurance is different. Every insurance is different, and some cover things, some don't. So
So what we always start with patients is we always verify benefits for them as a courtesy, find out exactly what the situation is, because again, there is so much complication. I'm sure patients can appreciate, you know, how complex the insurance landscape is these days. Even with the same company, there are so many different plans and so many different things that are covered and not covered and whatnot. So we always start with, let's look at your benefits and let's at least come to the table and find out. Now, that being said, moving forward, again, you kind of already alluded to this, but the thing we want patients to know is we've worked really hard to, number one, make this program extremely effective to really get patients the results that they're after. But number two, we've worked really hard to make it as affordable as possible. You know, if patients have looked into regenerative medicine and stem cell therapy and a lot of similar other approaches and programs like that, they've come to find that a lot of those are extremely cost prohibitive. And what we've done is we've done everything in our power to really try and make this within the grasp of just about anybody. We work really hard to help patients so that finances aren't a barrier in their getting the help that they need, so that they can, you know, get rid of the pain, avoid surgery, get back to normal life. And so that's another one. And then in terms of kind of what patients generally can expect with the program coming into our clinic, what does that look like?
You know, basically we start out again. If you don't have imaging already, we'll do imaging. We'll sit down with you, do an exam, figure out, you know, really identify if you're a candidate. That's the first and foremost.
Yep.
We got to find out if you're even a candidate. And then from there, we educate you on what kind of like step by step, how we're going to kind of lay things out. And then Amanda sits down, goes over finances, you know, what insurance covers, what it may or may not cover. And then we just kind of roll things out. Up front, we want to make sure there's no surprises with anything that we do.
Yeah.
You know, we want to make sure you know everything that's, you know, that here's how we're going to go about treating you, and then here's what it may or may not cost, and then go from there.
Yeah.
That's it. It's pretty simple.
And we take a team approach, and again, our whole philosophy is 2 heads or 3 heads or 4 heads are better than one. And so when patients come in, the team works together to really help each and every patient and provide them with the best level care possible, to make sure that your experience is phenomenal. And that's really what we're after. We want you to get great results, and we want to make sure that in doing so, that the experience that you have is a positive experience.
Pleasant, yep.
So anything else that we need to cover in terms of questions that patients might ask?
I don't think so. Or maybe how much time it takes. You know, I mean, our appointments aren't generally more than depending on if you have 1 or 2 knees, maybe anywhere from 20 minutes to 35 minutes or so
Yeah.
for the full treatment on everything each time you would come. So
and the
pretty
regenerative,
simple.
the regenerative medicine appointment itself, that specific appointment is unique because obviously we're injecting the medicine into the area, and that takes 15, 20 minutes.
Yep.
You know, so that might take a little bit extra time if necessary. You know, so if a patient's concerned, we have available to us advanced imaging. We have what's called a C-arm or a fluoroscope, so we can look directly at the joint if necessary to know that we're delivering the medicine right where it needs to go. More often than not, it's not necessary because the knee joint is just, in most instances, a fairly straightforward joint.
Sure.
We've got an amazing nurse practitioner that works with us who handles all of that.
Yep.
She's wonderful. And so we hope that this has been helpful and valuable for you in really giving you a better idea of what you can expect with this. If you're struggling with knee pain, don't struggle anymore. There's some really incredible options that are available to us that weren't available just a few years ago.
Exactly.
And that's what I tell patients all the time. I said, it's pretty incredible to think that just a few short years ago, we didn't have these tools available to us. And we live in a really incredible day and age now where we can do things we used to not be able to do to really help people. So in terms of what you can expect, obviously everybody is a little bit different. As much as we would love to promise and say we guarantee that this can help your knees as well, we obviously can't do that. So our invitation to anybody watching this is obviously come in for that initial evaluation. Let's find out first and foremost if we can help you if you're a candidate. And if it turns out that we can, we will take great care of you and we'll make sure you get great results. So anything
Nothing
final?
else.
So thanks for watching, guys. If you know people who are struggling with, if you or someone else you know or love is struggling with knee pain, share this with them and make sure you come in and see us. We'd love to help. And we appreciate you taking time to check this out. So we'll talk to you guys later. Have a good one.
Thanks for listening to the Health Fundamentals Podcast. Be sure to subscribe so that you stay in the loop and in the know with all of the cutting-edge health information that we share. If you know other people that could benefit from this information, please share it with them as well. Also, be sure to give us a review. These really help us to ultimately help more people. Last but not least, if you have questions that you want answered live on the show, or if you have ideas for topics that you would like us to cover, please shoot us an email and let us know at info@thehealthfundamentals.com.